ahead to Professor Dr. Connie Stumpel. She's Emeritus Professor of Clinical Genetics at the hospital in Maastricht, and has a presentation for us on her experience with Kabuki syndrome and also endocrinology and some hormone issues. And via the magic of Zoom,
over to you, Connie.
Over to you, Connie.
Hello, everybody. Thank you for the invitation to be with you. I'm very happy to be part of this meeting, even though it's only online from my own study. But I'm happy to be with you and share some of our experiences. I will give my screen right now. So, what I want to share with you is our Dutch contribution. And it's a story which starts in my personal experience back in the 90s of last century, where we saw the first children with Kabuki syndrome, and we formed a family network, and this is one of the first annual meetings. We had meetings and we did research, always based on questions from the families. What about behavior, what about follow-up, and especially what about the cause, because this was a lot of mixture in the beginning. In 2010 we learned about the mutation, and we could confirm as the second group from Maastricht with a spectrum of mutation analysis. This was 2011. And then we could confirm diagnosis in this elderly man in his 60s, where his use picture was quite clear, of course, but in his age nobody had recognized him so far. We were working along and we were recognized in the Netherlands back in 2015 as an expertise center for families with Kabuki syndrome. This was a whole and complex procedure organized by the ministry in a lot of European countries. And in 2016 we joined the ERN Ithaca, which was back then coordinated from Manchester, now from Paris, on congenital malformations and rare forms of intellectual disabilities. And Kabuki syndrome is incorporated in that. A lot of centers in many countries, and every 5 years we were renewed. Another project we did was cross-border. We live in Limburg, in the south of the Netherlands, and we did a cross-border project together with Belgium and Germany. And the goal was how to work together and improve the care for families where a rare syndrome is going on. And we achieved a lot, but there are still challenges, and there are mainly to do with health insurance issues. So this was the program, university, hospitals, patient organizations, and it was funded by Interreg, which is a big Brussels project basis. So another question that the parents put to us was, what about growth and hypotonia? And there were also children with Prader-Willi syndrome, and the parents told us they are so alike in that they are both hypotonic and they have both a growth retardation. Is there something to do with growth hormone? Because children with Prader-Willi syndrome get growth hormone. So that was the start for us to check growth, to look at growth and growth hormone. And this was all that was available by then. The curves by Norio Nishikawa, who showed that there was a postnatal growth retardation. This is an example in the males. And we defined short stature as that. So we did a study in our cohort, and left you see the height for the boys and right for the girls. And indeed, we see a postnatal growth retardation in height, which is variable, of course, but still quite clear. We had no correlation about genotype or phenotype for weight or height. Here, we started a study with growth hormone. We had 18 pre-pubertal children, 9 boys and 9 girls. And we were able, in a study protocol with the medical ethical committee, etc., you know how it works, we could do a study. And here we see the result in one of the children where we started with growth hormone and we see a significant rise in height. But the height was not our main goal. We really focused on the hypotonia. What would it do by there? And what about muscle fat balance? And it's all well written in the thesis that I sent to the organization. So people who are interested, please ask it. It's a digital version. And here you see a picture of a child which is in the ventilated hood measuring his metabolism. And we did all kinds of studies measuring that. And indeed, we could show that the effect of growth hormone was very positive on the hypotonia and that they really became stronger. We have nice examples of that. And that's the most important for the children and the parents, of course. So our colleague Nina Schott, she's a child endocrinologist. She did the study and she's sitting on the right, putting her thesis in the envelopes. And on the left is Merel Klaassen, the pediatrician from our team. And in December 2018, she could defend her thesis, which was positive with the doctoral bill on the right side. And the next step, of course, was how do we get growth hormone medication approved for all the children? And this was, of course, a discussion in the Dutch Pediatric Endocrinology Group. And they were really convinced by our data. And they advised the health insurance companies to finance this treatment. And so this was the case in the Netherlands back in 2019. And of course, the Netherlands is only one country. We want it to be available for all the children. So especially the children who are in our lay group in Belgium are really upset and frustrated. And so are we that in Belgium it's still not available. But we had some hopeful news that the pediatric endocrinologists in Belgium are willing to talk again. Because we also had a 2 years follow-up. When people say, well, it's only 1 year in the thesis, but here we have the paper with the 2 years follow-up of growth hormone treatment, and the results do stay very positive and really convincing. So if you would like to have this paper, it's also available through the organization of this meeting. There was another question from the parent lay organization, because we had a child that unfortunately died of some type of cancer, and in literature there are more case reports, and parents asked, is this a syndrome, is Kabuki syndrome a syndrome with an increased risk of cancer? So we did a very deep and detailed study with our resident by back then, Sietse Aukema, and we studied the syndrome of the tumor in a child with Kabuki syndrome, and a big literature review. And to be short, we could not document a concrete increased risk for any type of cancer. And we found up to now no need for any structural follow-up. But of course, we have to keep track of the records. So what do we do in the Maastricht Expertise Center? We do care and research, and this care, of course, is multidisciplinary. We are there for a second opinion, national and regional. We do a follow-up if the children live in our region, and we have specific clinics for the growth hormone treatment, which is national. And we see children from very early until late, and nowadays we also have diagnosis prenatally because of the better molecular genetic techniques. So this is what we can do. I say we, but I'm not involved in patient care anymore because I retired, but there's a group of clinical geneticist Margje Cinema and the pediatrician Merel Klaassen and her colleagues, and other colleagues as needed, of course, and also people from behavioral and psychology work with us in the team. So then we have a very active new patient lay organization network. I call it here the Dutch Kabuki network to avoid mix up with the Kabuki Foundation. It's the Dutch network. And they gave me a wonderful painting picture when I did my farewell lecture in the Maastricht University. This is their logo and their thing. We help people with Kabuki syndrome to get the most out of their lives. They do lovely things, lovely initiatives. And they have a scientific advisory board with a number of people and a number of background, which is important. And we are very happy with the collaboration. So where are we now? When we look back, we have a family network since the 19th last century, Dutch and Flemish. This has to do with language, of course. And we worked from a clinical diagnosis to a molecular diagnostics. We are an expertise center since 2015, and we are represented in Ithaca Reference Network since 2016. And we have the growth hormone therapy acknowledged since 2019. So we are never ready, of course. When we look at the future, we are very happy with a strong and professional lay organization. We work on a research agenda, and we are empowering and connecting families. And this is not only nationally, but also internationally. And we are very happy with the UK and the USA and Canada collaboration, of course. We need to do it together. And this is a picture I took myself in Egypt, where we had to get out of the boat because of the help to get on that ladder, and that ladder was needed to get us on the beach. So it takes a bit longer, but you go further. And herewith, I thank you for your attention.